Call is being bridged.
Squirrel. Oh, we don't have a name. Okay.
Good afternoon, my name ID number, and that will be your Haitian Creole interpreter. How may I assist you today?
Yes, I'm doing a postpartum visit with. She just had a baby, and so you can introduce yourself to her. I have you on a speakerphone.
Bonsoir, nous pas m'sé pas l'interprète, okay?
Okay.
Okay.
Okay. How is she feeling today?
Comment sens-tu aujourd'hui?
Moi, c'était une fièvre. Après ça, votre mère fait mal. Moi, allumé. Tout c'est un peu.
I had a fever, I have a cold, and I had belly pain, and I cough a lot.
Okay. Would she like me to order her some cough medicine?
Est-ce que vous voulez prendre des médicaments grippe pour?
Oui, s'il vous plaît.
Okay, yes. And I want her to drink a lot of fluids, and especially I want her to call out to the nurse and ask her to bring her a cup of tea. When you drink hot liquids, it opens things up and helps you to get over your cold faster.
Les délivrer pour boire un pile liquide, et puis après l'infirmière pour porter thé pour un thé qui chaud, parce que le boire thé qui chaud, ça aide un pile avec grippe là.
Okay.
Yeah, I mean, colds are caused by viruses. We do not have a cure, so we just treat the symptoms. So if her symptom is a cough, I'm going to treat her cough. If she gets a fever, we will give her Tylenol.
Grippe là, c'est un virus que lié par un médicament pour virus, mais si toutefois vous avez la fièvre ou vous tous, vous êtes capable de faire un médicament pour symptômes que vous avez.
Okay.
Does she have a name for the baby?
Quand bébé relé.
Okay, good. She's going to show me a paper, I think, that has the name on it. I'm going to write it up. Interpreter. Can you ask her how is she feeding her baby?
Qui soit ba bébé à boire, tété ou bien l'autre lait?
Mbali tete.
À breastfeed.
Okay, great. And did she have success breastfeeding her first baby?
Ou te ba l'autre premier bébé ou tété bien?
Oui, il était bien, mais ma femme qui bouche blessée, c'était
When I am breastfeed, I see that the nipple is very painful.
Yes. I would encourage her to try to make sure that the baby's opening her mouth really wide when she gets on, because if she takes a little tiny bite, her gums will be kind of chewing on the nipple, and it's very uncomfortable. But if she takes a big bite around the nipple, she pulls the nipple into the back of the mouth where everything is soft, and it's much more comfortable.
C'est important le ba bébé à tété pour ouvrir, pour rassurer que toute pointe tété à rentrer dans bouche bébé. Parce que depuis ces petits pointes là, la râler, la veine cause pointe la veine sensible à cause de gencive. Si la faute gencive là sur pointe tété, ça vient bonne douleur.
Okay.
Does she know how much the baby weighs? She's got a nice fat face. How much did she weigh?
Est-ce qu'on est combien bébé a pesé?
Non, moi pas songé.
She doesn't know. Okay, I'll look it up.
I'll get it.
Okay, she is postpartum day number 1 today. We're going to try to get everything ready so that we can send her home tomorrow.
Je dis à ces premiers jours, yo pral préparer toute bagaille pour capable aller la caillou.
Okay.
Okay, and I see that she got a bag of dark liquid in her IV. That is IV iron, and that is to treat anemia.
Les liquides ça quoi qui coule foncé qui nan sérum nan, c'est fer que li gagne là dans li et puis pour capable yo baoul c'est pour capable traiter anémie.
D'accord.
Yes, and she will get a second bag of that tomorrow before she goes home.
Y a bon deuxième sachet là dans encore demain avant qu'on aller la caillou.
Okay.
Okay, and who does she live with?
À qui est-ce qu'on vive?
Avec Marie.
With my husband.
Okay. And is he going to be helpful to her in the first couple of weeks? Will he be able to stay home at all?
Nan première semaine, yo eske mari wap kapab rete la kay pou accompagner ou?
Non, la travail.
No, he's working.
He has to work, yeah. Does she have other family in the area?
Ou gen fami nan zon nan?
Non, gon voisin nan yete nou.
I have a neighbor. She's very helpful.
Oh, perfect. Good. Good for her. And how old is her other child?
Ki l'âge lot petit ou? She will turn 3 years in February.
Okay.
3 years old.
Okay. Yep. Very good. Okay. So I also know that when she was admitted to the hospital, they were concerned that she had a urine infection, and I'm still waiting for the final result on what medicine will be effective for her urine infection. And so we will be prescribing her an antibiotic, but it's not for her cold, it's for her urine infection.
Lady, yo te remarke ke ou te genye yon infection urinaire, yo pral prescrit yon médicament qui capable aider ou avec ça, y a ba yon antibiotique. Antibiotique là c'est pas pour grippe là, mais c'est pour infection dans pipi.
Yeah, I think she had an infection of the urine during her pregnancy. Is that correct?
Ou te fait une infection dans pipi pendant période grossesse là?
Oui.
Yeah. Okay. It's easily treated, but when we prescribe an antibiotic, it's really important that she takes it all the way to the end, complete the treatment.
C'est facile pour yo traiter, mais les bon médicament faut qu'on prend li pendant période de temps que yo doit prendre là.
Okay, does she have prenatal vitamins at home?
Ou gen vitamine prénatal la kayo?
Oui.
Okay, she's going to continue taking them the whole time that she breastfeeds. So when the bottle runs out, she can just buy another bottle.
Pas oublier pendant toute période de temps, on va bailler TTA, faut qu'on prenne vitamine prénatal là. Si bouteille en fini, ou capable juste acheter un lot.
Okay, so when she goes home, she should be taking care of the baby and her other child and herself. She should not be cleaning the house, doing the laundry, cooking the meals, doing the shopping. No. 2 weeks, she's going to be at home with her babies, recovering herself and breastfeeding this baby.
Lè que ou rive la kayo, pendant premier 2 semaines yo, ou pas doit faire aucun travail dans kay la. Ou pas doit nettoyer, faire manger, laver rad. Ou doit simplement là pour prendre soin tête ou et puis prendre soin timon yo.
D'accord.
Okay, so I'm going to go ahead and just feel her belly. I want to see how her uterus feels. Can she just lay back in the bed a minute?
Coucher sous cabane nan, li pral examiner yo.
Confirm her uterus. That's a good thing. And her bleeding is very light. Okay, she is in good shape. Oh, yeah, and your breasts are perfect. Yeah. Okay, you can tell her that I will order her some cough medicine. And does she like tea? Can I bring her a cup of tea right now?
La voye médicament tous lan pou. Est-ce qu'on remet tel met pour te pour kounya?
Okay, good. And what is she and her husband planning to use to have a little time between this baby and her next baby? What type of birth control or family planning is she going to use?
Qui sont pral utiliser pour ka faire petit pendant qu'on fait tout faire petit lan la qui planning, qui type de planning ou pral prendre?
Nous pas comme qui planning qui gagne, mais nous devons pas planning.
I would like to do that, but I don't know the option that they have.
Oh, okay. They must not have given her much information. I don't really have, I don't have good information here unless if she wants me to, I can show her a website. Actually, I will write it down and she can look it up because it's at this website she can pick French Creole and it will tell her everything she needs to know about birth control. So I'll write it down for her. I'm assuming she uses the internet. I mean, everybody does.
Li même tout li pa konnen, c'est ça que fait li pral écrire website lan pour capable aller sous li ou capable option créole ou bien français pour capable comprendre et puis ou après qui type de planning qui gagne et qui sont ka utiliser.
Okay. Can she can she open her phone and I'll try to show her this website.
Ouvri téléphone nou, li pa yon tou website lan.
D'accord.
But it's pretty good. Bedsider.org. And everything that she needs to know about birth control is in here. And the reason I recommend this is because this is real information, not gossip. It's information she can trust.
Les éléments yo, c'est parce que ça c'est bon information que yo yé, c'est pas ça l'autre moun ap dit, mais c'est bon information, ou capable faire confiance, ou penser en li yo, et puis pour capable choisir une option.
D'accord.
And at the very least, she should have condoms around until she gets started on something else. She's going to come back and see us at 6 weeks postpartum.
Mais en attendant, c'est important pour utiliser capote et prochain rendez-vous avec eux, c'est dans 6 semaines.
D'accord.
Okay. Does she have the phone number for the Bordentown office? Was she making her own appointments?
Est-ce que gagne un numéro de téléphone office et qui dans Bordentown là pour capable mettre rendez-vous?
Moi pas gain, non?
I don't have it.
Oh, she doesn't have a number to call? Like, how was she making her prenatal appointments?
Comment te kon mette rendez-vous prénatal ou yo?
Yo te kon voye sur téléphone moi par email bon non?
They used to send it by email to me.
Okay, I will send a message to the Bordentown office and I will ask them to schedule her a 6-week appointment. That will be in February, and then they can email it to her.
L'après les office Bordentown nan pour yo capable mettre rendez-vous en pour dans 6 semaines c'est en février et puis ap voyer le ba par email.
D'accord, merci.
Thank you.
Okay, does she have any other questions for me? I'm going to make her a cup of tea, and I'm going to make her a 6-week appointment, and I'm going to order her some cough medicine.
Est-ce que vous avez d'autres questions? Yo pour aller mettre rendez-vous à pour et rendez-vous dans 6 semaines. Et puis, on va préparer thé pour médicaments grippe là. Et puis, on va tout voir pour. Est-ce que tu as d'autres questions?
Oui, moi, j'ai travail, moi, c'est bon, mon papier. Pour être capable de signer pour moi, s'il vous plaît, moi, va finir comment aider.
They give me a form from work, so I need you to sign it for me, please.
Where she had her prenatal care, she needs to take these to that office. Because it's not obvious to me where to sign, and we have a whole person who does this work. And if she drops these papers at the office, they will fax it to the person who fills them out and get it back to her.
Les dit wap bali nan office kote kon suive et pendant période grossesse là parce que lui même li pa aucun côté pour les siens wap bali et puis y a voyer le par fax ba moun qui doit remplir lien après ça voyer le ba.
Moi, j'ai pas dit déjà, oui, je t'ai pas mis un email, moi, que ce email là, je n'ai pas une personne.
I gave it to them and they gave me an email. So I sent a message to the email that they gave me, but they didn't answer.
Uh-huh. Okay. Yeah, I don't know what to say because it's not clear to me where I'm supposed to sign. There's no place that asks for my signature. Or else I'd be happy just to sign them, but there is no place here for me to sign.
Li pa tap gen problème pour li signer, tap content faire ça, mais li pa aucun côté qui demandé pour le signer.
Does she know where they want me to sign? Because I just don't see a place. I've been through these papers now 3 times, and there's no place asking me to sign.
Qui ba yo dit pour le signer? Est-ce qu'on connaît parce que li même pas aucun côté pour le signer?
Moi, pas connais, non, parce que moi, au bon livre, ça écrit, même pas connaître si c'est la policière.
I see a line. Maybe this is where you would have to sign.
No, well, they tell you if they want you to sign somewhere, they write underneath it signature, and then they give you a place to put the date on it as well. And there's no place like that on there.
Là que son papier pour yo signer, yo mette li et puis yo mette date là dans tout, yo mette côté pour mon signer, li ba ouais ça.
Okay.
Have her try Bordentown again. I'm going to come back. She can keep looking, but I'm going to go get her tea, and then I'll come right back. But I believe she has to take those to the office.
Li kwa se nan office la pou bay li. Li pou chercher thé à la vini.
Et je d'accord, merci.
Yeah, I'll be back with your tea. Can you ask her, does she just want sugar in her tea, or does she like milk as well?
Est-ce qu'on va ajouter seulement sucre dans thé ou bien est-ce que vous voulez lait tout?
Non, c'est sucre.
Only sugar.
Okay, very good. Okay, thank you, interpreter.
You're welcome. Have a good day. Bye-bye.
You too. Bye-bye.